If we can begin to take our seats, we can get the program started. My first order of business, first of all, I best introduce myself. My name is Al Harrington. I've got one hell of a good Irish name. I got this Irish name because an Irishman came over here during the Second World War. He married my mother, then I had to go along with the deal. Because when he married my mother, I was already there. It'll come to you on the bus, don't worry about that one. But ladies and gentlemen, I have been given the delightful task of welcoming you here, and then of course, beginning the festivities or the morning's program according to the Hawaiian protocol. And so allow me to do this, first of all, by thanking the governor and welcoming him from his adopted mother in Waianae, because I just left her. And she said to be sure to say hello to the governor. Aloha. My second order of business is to express the gratitude of Hawai'i and the people who are involved in this organization or this meetings that we have. To Bill Kaneko, founder, president, chief executive officer of HIPA, the Hawaiian Institute for Public Affairs. And with that introduction, please give this man a nice hand for the work that he has done. In the tradition of our people here in Hawaii, we thank you for coming because we who live here understand that the visitors industry is one of our major economic processes. And when you don't come, we don't eat good. And so we thank you. We thank you for taking the time out of your lives to come to be with us. In the process of protocol in these islands, we welcome you with the ancient chants of old Hawaii. I have two of these chants which was taught to me by my kahu, Kamaki Kanahele. And I share these chants with you as a part of the protocol and a part of the welcoming process for you who are here for the first time. For you who are accustomed to this, be patient. I, like you, am still learning the protocol of our islands. The first chant goes back to time immemorial, and I will translate it, hoping that you will also feel the poetry and the artistry that is embedded in the language of Hawaii. Ke kolma kolma kiai mai kalani mai. Oh, our ancestors of remote antiquity. E nana ia mai ka hale ola. Watch over a house of healers. My luna alalo from top to bottom. My kaikihi a kaikihi from corner to corner. My kauka ahe kai from the heavens to the earth. My loko avaho from inside to outside. E pale aku I nā ho'opiriki ana I ko kākou no hona. Ward off all that may infringe or disturb this gathering. The second chant I will not translate, but I will hope that you will sense the poetry, the artistry of the language of those who are first to these islands. ko mau kia e mai kalani mai. Ona I ka halame ke le hue halele hua no I na kanu. O ka uno e a no I nei e lia nei. O yo ka hiki mai, a hiki mai no oe, hiki punu me ke aloha. Aloha e, aloha kākau e, aloha e. Now if you will all repeat after me. Aloha. We will do that one more time with feeling. Aloha. E pule kako. Let us pray. Our Father, who art in heaven, we thank Thee for being able to gather in this place of beauty, fashioned by Thy hand. May Thy Spirit abide with us, that all that we do and say may be according to Thy will and grace. Inspire us to heal the sick, give strength to the weak, create peace in all that we do and say. Thy will be done on earth as it is in heaven. In the name of Jesus Christ. Amen.
Mahalo kahu for that wonderful oli. And good morning and aloha, and welcome to the 2013 Hawaii Healthcare Summit, presented by the Hawaii Healthcare Project. My name is Andrew Garrett of the Hawaii Institute for Public Affairs, and I've had the pleasure of serving as a project director of this initiative since it was convened roughly 18 months ago. First of all, on behalf of the Summit Planning Committee and everyone who worked so hard to make today possible, thank you very much for being here today for what promises to be a great day of learning, sharing, and networking with over 550 of your closest colleagues from across the state. On that note, I'd like to extend a special mahalo to our friends from the neighbor islands who are here with us today. I'm proud to share that we have attendees from Kauai, Maui, Lanai, Molokai, and Hawaii Island, making this a true statewide summit. By way of background, the Hawaii Healthcare Project is a public-private partnership that aims to engage stakeholders in identifying strategies that will result in significant, meaningful change in the way we deliver and pay for care, use information and data for continuous improvement, and shape public policy to realize a triple aim of better care, better health, and lower costs. We encourage you to learn more at hawaiihealthcareproject.org. And for those of you on Twitter, join the conversation today at #HIHS2013. Now it's my honor and privilege to introduce our MC for today's events. Ms. Beth Giesting was appointed by Governor Neil Abercrombie in September 2011 as the state's first ever healthcare transformation coordinator. In addition to serving as the co-chair of the Hawaii Healthcare Project, Beth continues to oversee the state's implementation of the Affordable Care Act and serves as both the governor's senior healthcare advisor and as the state health information technology coordinator. Those of you that know Beth know that her remarkable career has been guided by her unwavering commitment to helping out the underserved in our community. Prior to taking her current position, she served as a president and CEO of the Hawaii Primary Care Association, where she tirelessly advocated on behalf of the 14 community health centers that deliver care where the need is greatest. And before that, she had served as the executive director of the Kalihi Pālama Health Center, one such CHC, here in Honolulu. So ladies and gentlemen, without any further ado, please join me in welcoming your MC for the 2013 Hawaii Healthcare Summit, Ms. Beth Giesting.
Good morning, everybody. I think Okay. Well, good morning, everybody, and I will try to speak into the microphone so that you can hear me. I want to start by saying how very pleased I am to see so many people here, over 550 people who care about health. And that really is remarkable because we here in Hawaii have not always been paying that much attention to the status of health in our state. We have not had to go through some of the soul-wrenching discussions about the uninsured because of our Prepaid Health Act and our expansive attitude about our Medicaid program. And yet, although we typically have a very low uninsured rate, our healthcare system is plagued by some of the same problems that occur everywhere. We have fragmentation, we have unsustainable costs, and this summit here today is really about conveying all of the different things that are going on in our community to address those. We really do have solutions on the way. Everybody is aware of the Affordable Care Act, which is a crucial catalyst for changing our healthcare system. We also know about our insurance exchange, the Hawaii Health Connector, and that's an important tool to make sure that we reach universal coverage. But we'll also be hearing and emphasizing the many threads of activity all across the healthcare sector and indeed all across society, because businesses are also getting into the act and encouraging wellness and transforming our healthcare system. So that's, ladies and gentlemen, what our summit is about today. And so as I begin this meeting, I would like to take the opportunity to thank some key people, including, of course, my boss, the governor, who has a keen and foresightful interest in healthcare. Our partner, the Hawaii Institute for Public Affairs, and especially recognizing its director, Bill Kaneko. And I especially want to recognize Andrew Garrett because this conference really could not have taken place without his extremely dedicated work in getting it all organized for us. My co-chair in transformation, Ginny Pressler, and we'll be hearing more from her later today. Our legislators and directors and staff from across state agencies, because healthcare policy is going to be in the forefront, and our other stakeholders in transformation, many of whom are going to be speaking in breakout sessions today. So, in addition, I'd like to publicly acknowledge our sponsors. Platinum sponsors are HMSA, the Queen's Health System, and Hawaii Pacific Health. Our gold sponsors are the Hawaii Health Connector and Kaiser Permanente. Silver sponsors, United Healthcare, the Kidney Foundation of Hawaii, and Liberty Dialysis. And bronze, AARP and PACSA. In addition to them, I would also like to recognize Olelo, who's our special media sponsor. So we have exhibitors in our lounge, and I encourage you to visit them through the day. Leave your business card, and at the end of today, we are going to do a drawing for autographed hard copy books written by one of our keynote speakers, Dr. Abraham Verghese, who wrote the New York Times bestseller, Cutting for Stone. And the drawing will be at the end of the day, and you have to be present to win. So I know that you'll want to be anyway. I also would like to make sure that you note that in your conference brochure, there is the program on the back for your convenience, and also a diagram of where all the rooms are. And there are note cards on every table, because the way we're going to be dealing with question and answer today is by having people jot down questions or comments that you want to present to the speakers. And so now, finally, it is my great pleasure to introduce my boss, Governor Neil Abercrombie, a man who really gets health and healthcare, and he has spent years of listening to advocates, having been in Congress and in the legislature and in the city council. So he really understands what the problems are and the solutions, and For healthcare, he wants to be working with our many stakeholders. He wants to make sure that our solutions are patient-centered, and he especially wants to make sure that we have universal health coverage. So, thank you.
Thank you, Beth. Thanks, Beth. Can you get that? Thank you very much, Beth. Aloha, everybody. Thank you for that wave of enthusiasm. Aloha. Yes, because this is our opportunity. There's 500 plus people here in this room that not only have that opportunity, but I expect from you some action coming today that I can, in turn, transpose and translate when we come to the upcoming legislative session in January. I'm putting a budget together now. I'm putting my policies together now with respect to what we're going to be recommending to the legislature. I'm going to be following everything that takes place today, all of the papers, all the rest of it. Everybody who knows me knows that homework is something I've been doing all my life. I came to the University of Hawaii as an academic, and sometimes people think I haven't been able to leave that behind as governor, and that's probably true. I don't consider anybody here today is going through the motions. If you are, I think you're in the wrong place, because I intend to utilize the work effort that comes out of today as the foundation for that which we have been putting together right straight along since I put forward my proposals when I ran for office. I've talked to Herb and others. Mr. Weil and others aren't necessarily familiar with me, but they will be by the end of the day, I can assure you, by the time they leave Hawaii. We, as Beth indicated and as Mr. Garrett indicated and others, we've been in the forefront. In some ways, we've been able not to be complacent, but to kind of stand aside and wonder why other people haven't done and didn't do what we did back in 1975. Now, I relate to that especially because that's when I first began my experience with it. When Beth makes what would otherwise be a pro forma remark about the governor's very interested in health care and so on and its transformation, and Beth was kind enough to recite my lengthy legislative history, which is another way of saying, God, he's been around a long time. The plain fact is I joined Kaiser Permanente in September 1959. Anybody here been a member longer? No. Right? And I can remember because I remember watching Henry Kaiser come out from his appointment when I was going in. And for those of you who are rookies here today, the hospital, Kaiser Hospital, the clinic, the hospital, everything, your primary physician, all in the same building. It's where the Hawaii Prince Hotel is today. That's where Kaiser was first located. And so I've followed it now for 5 decades. I can remember Patsy Mink and I sitting in the office when President Clinton and Secretary Clinton were trying to put together the health care plan at that time. And I remember Patsy and I at one point saying to him, as I think the original Clinton care plan got up to about 1,500 pages, and saying, you know, you keep citing Hawaii in terms of health care and understanding how insurance can be universal and applicable in terms of health care. But, you know, between Patsy and I at that particular time, we have 44 years' worth of experience in dealing with the legislative foundation for the application of health care into the broader community. And you folks don't have 44 seconds. Now, we didn't mean it to be sarcastic or to be condescending or patronizing. What we're driving at is that everybody keeps trying to avoid what the fundamental idea needs to be here. And what that means to be is the kind of thing that it was mentioned by my dear friend Al Harrington in his opening Oli and in his prayer and his remarks, his personal remarks to me. I've been hanai to Auntie Aggie Cope of Waianae Nanakuli for many, many years. For those who are visitors and don't know the term hanai or its meaning, that means I've been adopted. And there's no formal papers, there's no written record. What it means in Hawaii is that we don't want to have any child without a parent. We love one another and care for each other. It doesn't matter if you're not blood kin. My mother and my Auntie Aggie spent many, many hours and days together, and my mother was delighted that Auntie Aggie felt sufficiently deeply about me to hanai me to her family. Al's mentor is my brother, Kamaki Kanahele. That's the kind of connection we have. We care for one another. So the prepaid health care plan in Hawaii was just a modern innovation of what the whole ethic and ethos of Hawaii is all about. We're island people. We're 2,500 miles away from the nearest landmass. We have to care for one another if we're going to have a real sense of family and community, and that has to be expansive. So when I ran, it was no secret. I will quote to you exactly what I said in 2010. The legislation signed by President Obama creates new requirements of the state for which we must be prepared. It also has numerous opportunities to obtain federal help in upgrading our system of health care by improving care for the needy, expanding the use of health technologies, and increasing numbers of health professionals, supporting seniors and small businesses, and securing funding for hospitals and health centers. Now, it wasn't because I was especially prescient in that. That's, to me, the sensible foundation upon which we have to operate. And everybody who knows me knows I'm a retail politician. That's what we're going to do. Now, we've got there have been some barriers put up by the political Visigoths that have taken over certain sections of the Republican Party in Washington, and who aren't offering any solutions and are not trying to help us get through any of this. And as far as I'm concerned, I'm here to tell you today, the reason that your meeting is so important here is I want us to concentrate on the positive side of things, of what we're going to do to correct whatever needs to be corrected, to deal with whatever we have to deal with, to see that this plan, which I ran on and which I'm implementing, in fact, I invite anybody, this is a real good plan, New Day for Hawaii. It's very, very good. It's comprehensive, and we're carrying through in every part of it. And the health care part of it is probably the single most important element in it. We're going to retail it, whatever we have to do. We'll take the health care proposals out there. There's a reason that we put together the corporation that we did, and that the legislature put it together the way we did here in Hawaii. And that's because we intend to take it out to people. Now, I'm all for high technology, information technology, and the sophistication of modern means of communication, Facebook and internet and going online and the web and all of that. Although everybody who knows me knows I much prefer parchment and quill pens. But I understand all of that. But here in Hawaii, and it's important for Mr. Weil and our other guests to understand, the overwhelming majority of the population is covered, and is covered well. The reason that we have what I call the 10 essentials, and the 10 necessities, the essential point, I call them necessities, is we agreed on this. And the reason that HMSA and the other and Kaiser and the other health insurers and providers are involved in our organization is I want everybody inside. I don't want people standing around on the outside waiting to take shots at one another to see who can score points. We're all in this together. But we've got to retail more of it. We have a small population of people that needs to have insurance at all, and we got to make sure that the small businesses who are providing insurance are able to meet the 10 necessities in a responsible fiscal way. Not because we're spending more. If I hear that one more time coming out of Washington, I'm going to gag. It's not the spending, it's the costs. The costs are rising. We have to get the costs under control, and that's what we're going to do. We need to retail it. What we're going to do, and I'm going to let the connector and everybody else come to this conclusion, but what we're going to do, and I know I'm going to get legislative support for this, is I'm urging everybody right now, go to where the people are who need it. They're not necessarily internet savvy. They're not, they don't have computers. They're not able to get there. To be able to do that. That may be too sophisticated. We've got federally qualified health centers right now all over. Waianae Comprehensive, Kokuakali. You got Long's Drugs. There's ads all over the time. Lee Cataluna's always writing plays. People at Long's, right? What they do, what they say. So we'll set it up there and put people there. We'll go to where the people are. Go to where the people who need the insurance and need the information are, and have human beings there who are going to take them by the hand and guide them through it and get it done. That's what we're going to do. That's what island people do. So I'm very, very optimistic that we can put this together. I am here to tell you that the president has had to fight up a mountain of opposition of people who don't want to extend health care to everybody in this country, who for whatever set of reasons want to continue to make money off of other people's pain. And that isn't what we're going to allow out here in Hawaii. That's not going to happen. The president's plan is going to be backed up. This administration is going to back it up. We're putting an administrative apparatus together to see to it that gets done. And we're going to have universal coverage out here in Hawaii. And the conclusions you reach today and the perspectives that you can provide here today I am confident, provide an even firmer foundation for what we're going to pursue here in Hawaii. Everyone in Hawaii is going to have the kind of health care and health care insurance that we have determined meets the basic necessities on a universal basis. That's what the 10 essentials are. That's our 10 commandments. And those are the things that we're going to accomplish. So help me God. Thank you very much.
Thank you very much, Governor. That was really inspiring and a great start to today's meeting. But we're going to be moving on. I am very pleased to introduce Mr. Herb Schultz, who is here with us today. He is the Regional Director for the U.S. Department of Health and Human Services in Region 9, which includes Hawaii, of course, California, Arizona, Nevada, the Pacific territories. He was appointed by President Obama in April 2010 and serves as at the pleasure of Secretary Sebelius. And I am going to cut the introduction short because I want to give him as much time as possible to deliver his message. So, welcome, Herb.
Yeah. Aloha. Good morning, everybody. Thank you for having me back. And I've got just a couple of minutes to share a few thoughts with you on behalf of the Obama administration and my boss, Kathleen Sebelius, Secretary of HHS. And as I start, I really just wanted to talk about a couple of things. I wanted to mention really leadership, the leadership of the people of Hawaii, and the catalyst that Hawaii and its people are. And as I sort of make a couple of brief remarks, I need to show you a video, and I was basically told 2 minutes before the video, 2 minutes after the video, get off the stage because we've got a lot of work to do. So let me put it out there. Hawaii, as the governor said, prepaid health care and the Prepaid Health Care Act. Now, I was a geek, I said, okay? I was a geek. And in the 1970s, when I was a kid and I started thinking about politics and watching TV, you know, the 3 stations, for those of you that are young, you won't understand that, the 3 stations that there were. And I knew what Hawaii was doing. And I eventually went to school in Washington, D.C., and actually got to watch a then Congressman, Neil Abercrombie. And we know at the federal level that the leadership of the people of Hawaii in the Prepaid Health Care Act And as you can see from the leadership of this governor and this administration and your leadership, that the Affordable Care Act, just like Prepaid Act, is a catalyst to great transformation. And that's happening across the state of Hawaii, across the country. And I want to mention one unique thing. Think about it for a second. Think about 1974 and 5. How many of you were not here in 1974 and 5? Okay, you can leave now. Okay. Think about 1974 and 1975, and Hawaii leading the way, and the fact that 92% of the people are insured. Think about the fact how unique Hawaii is now and the people of Hawaii, because very few, if any, leaders have the ability to have represented you and your leadership in the Congress of the United States, and now serves as governor to lead that implementation. He had your back then, he has your back now, and I think we owe him all a great round of applause. So thank you, Governor, for your leadership. What I appreciate most about this governor and about all of you is that we know at the federal level that the Affordable Care Act is a framework. And it didn't happen just because Washington decided it would happen. It happened because of all of you. It happened because of community. It happened because of consumers and providers and labor and business and our Native Hawaiian community and all the people of Hawaii working together to make this happen, our providers, our plans, and all of that. But what you all know and why you're here today is it's about the state, the local, the tribal, in my region, the territorial, and the people connection. It's communities educating communities. And I want you to give yourselves a round of applause because it's your leadership that is helping this governor, this administration, together the people of Hawaii, I'm confident, are really the leaders in this transformation of healthcare. So give yourselves a big round of applause. So I'm going to be here all day. My pitch is going to be, I've got a little space back there. I want to connect with old friends. I want to meet with new ones. You know, in my role as regional director, I have always, over the last almost 4 years, this is my 6th or 7th trip here, committed to you that 24/7, my availability on behalf of the Obama administration to help this governor, this legislature, all of the community and the people of Hawaii to achieve that transformation. So I'm going to show you a brief video by my colleague Cindy Mann. She is the national director of our Medicaid program. Because Cindy wanted to say a few words because we know transformation is not just on the private side, but it's on our Medicaid side, it's with our veterans, it's with our active service people, it's throughout the community in every form of insurance, whether it's through the new Hawaii Health Connector, whether it's through MedQuest. So I think Cindy's going to say a few words. I'm going to come back. I'm going to do what I normally do, and that's I'm going to ask you to take out your cell phones, your smartphones, your Blackberries, your Blueberries, your iPhones, and take down my cell phone and take down my email. Our commitment to working with the people of Hawaii is steadfast. And with this governor, with this legislature, and with all of you, we're confident that Hawaii is going to achieve the healthcare transformation, the leadership that you showed with prepaid, the catalyst of the ACA, and now the ongoing implementation to transformation. And so I want to congratulate you on that. So let me turn over to Cindy Mann really quickly.
Hello. I'm Cindy Mann, Deputy Administrator for the Centers for Medicare and Medicaid Services and Director of the Center for Medicaid and CHIP Services. I want to thank the Hawaii Healthcare Project for putting on this important event and send you my regrets that I was unable to attend. But I did not want to miss the opportunity to address such a diverse and engaged audience that has a passion for something really very important to the Obama administration, which is healthcare innovation. Throughout the nation, in both the private and public sectors, attention is focusing on new ways to improve healthcare and to lower healthcare costs. Medicaid is no exception. In fact, I would say Medicaid is a leader, triggering innovations not just in Medicaid, but also across other payers. Today, Medicaid is a program that's really focused on streamlining operations, improving the enrollment experience for people, and covering every single eligible person, while at the same time we support innovation and flexibility, all to ensure that beneficiaries have access to high-quality services delivered through effective and efficient systems of care. As we like to say at CMS, because of all the changes going on, it's not your grandfather's Medicaid program. The Medicaid program provides, as you all know, care for tens of millions of Americans, including more than 260,000 people in Hawaii. And it plays an especially critical role in providing coverage for children, pregnant women, individuals with disabilities, and seniors who need long-term services and supports. This means that Medicaid can be very critical support in particularly driving innovation in those areas. As a result of the Affordable Care Act, Medicaid will also, of course, play a pivotal role in providing coverage and care to all low-income adults. With the existing flexibilities in the program, along with new tools and options made available through the Affordable Care Act, CMS and the states have a platform to adopt a broad range of improvements and innovations in the Medicaid program. Hawaii, of course, has been a state leader in healthcare innovation. Dating back to 1994, Hawaii expanded its Medicaid program to provide dental, medical, and behavioral health services, and it has expanded coverage to new populations, and it has tested new delivery systems as part of a Section 1115 demonstration. You've got a lot of history behind you. Now, as a state innovation model design grantee, Hawaii is one of a few states chosen to create a healthcare innovation plan that will help focus your innovation efforts and help you apply for further innovation testing grants in the future. Hawaii's focused on patient-centered accountable care has the potential to drastically improve quality and access to care while keeping costs under control. And Hawaii's decision to take up the extension of the Medicaid coverage made available by the Affordable Care Act is another tool the state has to improve care and to build on the eligibility expansions already implemented in the state. Your decision to join the growing number of states who have chosen to take up this generous federal deal to extend Medicaid puts you in a position to make major leaps forward for the health of your residents and for the strength of the Medicaid program. State health care plans and providers, as well as consumers, in our view, are in the driver's seat. You face challenges, of course, but also great opportunities to really take delivery system reform forward. System delivery changes, payment reforms, and innovations are taking hold across healthcare system, and Medicaid is a full partner in those broader healthcare system designs aimed at driving innovation and improvements in care. There is, and I really want to emphasize this as you continue your meeting together, there's no one-size-fits-all solution from our point of view. And I want to let you know that we at the Centers for Medicaid and CHIP Services, along with our colleagues at the Innovation Center and those who work on the Medicare side, will do everything we can to support locally driven efforts to improve care and lower costs in Medicaid and across our healthcare system. In Hawaii, you've led the way, and I know you'll continue to be an example to all states in how healthcare innovation can be done right. I look forward to strengthening our ongoing partnership with states generally, as well as with Hawaii in particular, with beneficiaries, with consumer advocates, with healthcare providers in this important work of improving care for all Americans. Thank you for all that you're doing.
So in conclusion, leadership, catalyst, Thank you to the Institute of Public Affairs, to the Hawaii Healthcare Project. And you know, when I stop and I think, and I've been thinking a lot as I made the trip out here, and had a really great first day yesterday in meeting with many of you and meeting across the Abercrombie administration, I started to think about, okay, prepaid, and we get to ACA, such the leadership. And who is the first state through the governor to declare, we're going to do our own marketplace here, we're going to do it the Hawaii way? And that was Governor Abercrombie, that was all of you. And so congratulations for continuing Hawaii's leadership. I am extraordinarily proud to represent you on behalf of the Obama administration and our secretary. I'm going to give you the cell phone. I'm going to give you the email. I'm going to be here all day. I really welcome meeting as many stakeholders as I can, as many of the people of Hawaii in our communities, because it is, as the governor said, it is about communities, educating communities, retail, getting out there, and that's exactly what all of you have done. So you got those cell phones out? It's Herb, H-E-R-B, not a Herbert. I don't have time to go into that story, but it'll bounce back. So Herb, H-E-R-B, Schultz, it's spelled the East Coast way, sorry you can hear the accent, S-C-H-U-L-T-Z, that's Herb.Schultz, S-C-H-U-L-T-Z, at H for health, H for human, S for services, .gov, and then it's area code 415-265-7049. That's 415-265-7049. It texts, it emails, you can call me. The bottom line is that we feel very, very strongly about the great partnership that we have with the people of Hawaii, for the leadership of this governor and this community, and we will continue to do that. So congratulations, have a great day, and I look forward to being with you more. Thank you.